gives me great pleasure to connect with you today at a stage when so many things are happening in the evolution of healthcare access as well as on technology. And the domain of health tech is evolving at such a tremendous pace. I would first like to praise and acknowledge the Prime Ministers of both the United Kingdom and India for their partnership and their vision to come together in this sphere to enable greater access to people using technology, especially in the realm of healthcare. At Apollo Hospitals, we have been extremely happy to continue to partner with the United Kingdom on various levels and dimensions. There is a lot that one can learn from the United Kingdom in terms of the use of technology in healthcare. At one level, how it can assist in process enhancement, patient access, looking at a continuum of care of patient services, which the NHS is so well renowned for, and also now taking this to a higher dimension of using some of the newer technologies like artificial intelligence to enhance the way care is delivered, diagnoses are made with greater precision, greater speed, and with greater value for the time spent by the healthcare professionals. So it's clearly a very exciting domain. In terms of the entire manpower shortage situation, the NHS is a system which is respected and revered across the world. In fact, about 30% of doctors within an Apollo ecosystem have actually been trained in the United Kingdom. So when we hear that the NHS is short of doctors, not having nurses, their long waiting times, it feels like a significant thing to do to assist in some way to alleviate the pain of that system. And so what we're trying to do is find appropriate manpower in the nursing domain, in radiology, in emergency physicians, to move into the NHS for a temporary period of time after they are appropriately trained in UK protocols, so they serve there and then return back to India. I think the period in the UK, which would be 3 to 5 years, would be useful for them to enhance their knowledge and also contribute meaningfully into the UK health system. So this is truly a win-win-win for the NHS, for the Indian healthcare ecosystem, and for the individual who has this opportunity to go in and serve in the NHS and come back. So that's an exciting opportunity. One of the oldest and most significant partnerships that we have had with the United Kingdom healthcare system is with the Royal Colleges. The Royal College of General Practitioners, the Emergency Medicine, the Royal College of Surgeons, in the work they have done in training, in degree certification, and in helping the Indian healthcare system enhance their skill sets through these certification, training, and exams. So I really would like to acknowledge the tremendous partnerships that we have had with them. I think also that as the world evolves at the hectic pace that things are changing, the consumer is someone we need to keep in mind. The fact that non-communicable disease are the single largest killer across all dimensions, and NCDs are primarily lifestyle-related disorders. So healthcare is now going to become more consumer-centric. The consumer is used to engagement with other services, be it banking or airline, in a very different manner. That consumer centricity, tech enablement, mobile ready, personalized type of interface is what we seek to bring into the healthcare system so that we are proactive, personalized, and preventive in our approach to healthcare. And I'm sure that many of the exciting discussions which are going on today and under this initiative, which was conceived and accelerated by both the Prime Ministers, will help this vision. I must also make a mention of the fact that India is on the verge of an extremely exciting growth in terms of enablement and accessibility to care under the Prime Minister's Ayushman Bharat scheme. This will, for the first time ever in the world, be one of the most ambitious schemes to enable health access. So our vision is to really find a way to partner with the government to use appropriate health technologies to enable access, which then creates high quality yet value-based at the lowest cost type care, which will bring quality healthcare within the reach of Indians, and ultimately I believe that this model can be copied by many people across the world. We have over the years through all these partnerships been really ably assisted by the UK High Commission, both in Hyderabad as well as in Chennai and also in Delhi, and we commend them for their partnering and pioneering attitude towards all these initiatives. It is my pleasure to welcome all the delegates for this exciting exchange that you are going into today. I thank you for making Apollo Hospitals a part of this. We intend to contribute in every possible way, and I believe that we're opening up the doors, the windows, the hearts and the minds to a new era of advanced healthcare, which is accessible, affordable, of high quality and extremely personalized and transformative in its approach and its outlook.